circumstances. Thank you so much that you could sacrifice your Saturday morning, as I earlier mentioned. You know, we all like to sleep in on Saturdays. So welcome as we, today commemorate the Open Data Day, which usually falls around this time of the year annually. And this year specifically, it's falling on today, Saturday, the 6th of March, under the theme Data for Equal Development. Really this day just brings to attention the benefits of open data and to encourage the adoption of open data policies by governments, businesses, and civil society actors. My name is Bulanda Nkhowani, and I'm a program officer for Southern Africa under Paradigm Initiative, and I will be your moderator for the day. Also, just to say that this discussion is made possible by the support of the Foreign Commonwealth and Development Office, otherwise known as the FCDO. So this morning, as we discuss promoting transparent data governance within Southern Africa, really with a Southern African focus and also Africa-wide focus, and in the context of COVID-19. So just a bit of context before we go into the introductions and into the business of the day. I think we'll all agree that with the right data, we can almost solve all of the world's pressing problems, including public health threats like the novel coronavirus. And we also agree that during the pandemic, we saw an influx in COVID-19 data sets as nations were battling to flatten the curve and to find possible solutions in terms of vaccines and treatments. So which is why we are here today to discuss promoting transparent COVID-19 data governance in Southern Africa. And to do this, I have 3 speakers, and apologies for not having my video on. I don't have the best of connections today, so I'm avoiding being kicked out, and I think I'm the only host. And that would be really sad if the only host gets kicked out. So with this discussion this morning, we have 3 speakers. I have Nashilongo, I have Jimmy, and oarabile. So I will give them each a minute or 2 just to give us a quick introduction into who they are and what they do. So Nashilongo, we'll start with you, ladies first, since International Women's Day is falling on Monday. So we start with you. Please go ahead.
Thank you, Bulanda, and thank you for this opportunity. I would like to first apologize for running a little bit late today. Yeah, it's those Saturdays. I thought I had my times in order, but I totally missed that. So to introduce myself, my name is Nashilongo Gervasius. I am based and I'm Namibian. Amongst the many things I do, I'm a digital policy consultant. I'm also a lecturer of media at the University of Namibia. A few years ago, I've started the Internet Society, the Namibia chapter, and recently also the Digital Foundation of Namibia. I've been in the digital rights space for some times and have been intersecting with number of topics, including obviously data governance and issues of transparency to that extent. I've been also a researcher in issues around gender, government transparency during I think for the past 9 years or so. Yeah, so basically to start off, that is who I am and what I do. Currently studying at the London School of Economics and Political Science. That's amongst the other things I'm doing. So I'm excited to be part of this discussion as we interrogate particularly issues of open data governance, governance around COVID. As we have seen, there's been a number of inconsistencies amongst different governments in how, what data do they provide during COVID, what data do they make sure that it's out to the public, and what do they hold out. I think it's going to be an interesting conversation. Thank you.
Thank you very much for that introduction, Nashilongo. Over to you, Jimmy.
Good morning, everyone. My name is Jimmy Kainja from Malawi. My full-time job, I teach at the University of Malawi, Chancellor College. I teach media, communications, and cultural studies. Among many other things that I do, I'm a researcher, most interested in digital rights, internet freedom, and freedom of expression. I also blog on several issues. Yeah, I'm excited to be here to have this discussion. In particular, I think also because my country, Malawi, has had a completely different sort of scenario around COVID-19 with elections and whatnot. So I'm excited to be here. Thank you.
Thank you very much, Jimmy. Oarabile?
Hi, everyone. I'm Oarabile Mudongo. I am from Botswana, currently in South Africa. I am a technology exchange fellow with the Ford Foundation and the Media Democracy Fund. I also work with Research ICT Africa as a research fellow, specializing in AI policy and governance. Most of my work actually is more focused on public interest technology and social justice, and intersects between digital rights and data privacy. I'm currently studying for my master's with the University of Witwatersrand in South Africa. I'm actually looking forward to this discussion and getting to learn from each other. Thank you.
Thank you very much, Oarabile. I can see we have quite an able pool of speakers, and of course, you, our other participants, to tackle this topic today. So before we get into the discussion, if you check the chat section, I've just pasted some hashtags and Twitter handles and other links. So as we engage in the discussion, I'd encourage each and every one of us to tweet using the following hashtags: Open Data Day 2021, Data Rights, or Restored Data Rights. You can also tag the following handles: COVID Action, at Open Institute, and at Paradigm HQ. I would also encourage you in your free time to read the Declaration on Restoring Data Rights. I've pasted the link there, which is basically a normative standard that was developed by CSOs to ensure the protection and respect for human rights, including in the cyberspace and on personal data protection. And I've also pasted a link on a survey that I would encourage each and every one of us in this discussion today to complete. Even as we discuss, if you get a minute or two, please go through that survey. So thank you very much. Warm welcome to everyone once again. And also just to mention that this discussion is made possible by the support of the Foreign Commonwealth and Development Office. So just to start us off and to break the ice to our speakers. Firstly, so should COVID-19 data be made open or should it be kept closed, especially at the global level? Oarabile, would you like to go first? And then we'll have Nashilongo. Should data be kept open or closed, especially at the global level? Just a bit of an icebreaker.
Well, I think that's an interesting question, because when the COVID-19 pandemic started in Africa, it actually really taught us that, you know, one clear truth is, or should be, the value of timely and publicly available data for governments and other stakeholders to curb the spread of the virus. So indeed, fighting COVID-19 must be driven by the principles of transparency, accountability, and of course, participation to the COVID-19 response by both governments and the stakeholders that possesses this data that we're talking about here. It is in moments of disaster response and relief that the values of open government can come under intense pressure, like what is happening at this moment, but it can also come as a meaningful contribution to better outcomes while we are trying to contain the virus. But what's more important here, and the questions that we probably would want to ask here, is the open governance and management models that we think would be necessary for African governments to adopt in this case, and of course the implications. So one question that perhaps we would want to brainstorm along this discussion is, to what extent is management guided by open governance? For instance, how participatory, transparent, and accountable are decision-making processes and devices that are generating this data involve the community or the people? And how do governments currently make space for more open governance in their management processes? Thank you.
Thank you very much, oarabile. And I have noted one of the questions that you posed. So perhaps now we can go, Jimmy will follow after.
Sorry, there was a blip there and I couldn't hear for a second or two what Bulanda was saying. So, but I assume that it is me and then Jimmy follows after, right?
Yes, so we are still on the breaker on whether COVID-19 data should be made open or it should be kept closed.
Right. Just building on what my colleague Oarabile was saying, that with the outbreak of COVID-19, we have seen how government decided that it was important to make sure that public data should be available in order to contain the pandemic. In that case, in particular, I think this has been a norm in a lot of countries, was that then there have been many countries introduced what is known as the daily updates, where specific data is publicized or is released to the public in relation to new cases, what district they come from. And that has become particular important data, and also specific information for the public to protect themselves, or to be able to make decisions to keep them safe. And in many countries like myself, it must have taken a lot of people back, given the fact that, for instance, there's no access to information bill, or there's not even a data protection or data usages bills in place. So yes, there is a need, or there was a need, and that need remains. And I hope that the sort of transparency at whatever level that it has been displayed at this remains for the rest of our being, even beyond COVID, because it has shown that actually there is public data, that government does have public data, that they can use it, or but ordinarily they were not able to share it at whatever level it has been. Thank you.
Thank you very much for those insights, Nashilongo. Jimmy?
Thanks. I think I would generally like to agree with what the two speakers have said. I think one of the main things that we've had to have in mind here is that with COVID-19, we don't have precedence, so to say. I mean, in all our living time, we haven't had such pandemic. So how to handle things, I think we are all learning as we go. But I think one of the main positives that I've noted, at least for Malawi, is that the government, actually, they're having daily updates. So we have some sort of an infographic that tells you how many people have been admitted in the last 24 hours, new cases, how many people have died, recoveries, and all that. I know that sometimes, for example, around early February in Malawi, I think the cases were very high. It could get depressing looking at the numbers of people getting infected and people dying. Sometimes that can also have negative consequences in inciting fear and all that. But it's important that we have data available so that we all make informed decisions. I think that has been very welcome. But also, I think in most African countries, certainly in Malawi, in parts of Malawi, rather, we tend to have a lot of sort of mistrust between maybe the public and the governments, because how sometimes politicians conduct themselves. So it's important that we have open data so that people may actually have some sort of trust in the governments, because what is happening at the moment is that we have a lot of sort of open spaces where people are discussing issues, and social media platforms, for example. So in absence of this data from government and stakeholders, what you do basically is you're creating a vacuum where misinformation comes in and all that. So it's important that governments and stakeholders actually are in forefront in providing data, in particular to do with COVID-19. Thank you.
Thank you very much, Jimmy. I think we're all in agreement that, COVID-19 data should be made open and accessible. And Jimmy, you touched on a very important aspect of it helping us in making informed decisions, which pretty much leads us to our next question, which is, what could this mean for all of us in Africa, or rather for African countries? So imagine a situation where we could have equitable access to tap into this, huge pool of COVID-19 data at all levels. So, regionally, globally, even at national level. How then would this help us in, coming up with response measures? Nashilongo, would you like to go first? And then Jimmy can build upon that, and then oarabile.
Yes, all right. So building to what Jimmy was saying, and also previously what I was talking about, we have found out that, it was surprising rather that to know that government can actually use data and to manage a pandemic in that case. And to a lot of us, especially researchers, at the back of our mind, we have been asking, so it is possible that after all these years, government can fast track, can contain, can plan with immediacy, given the provision of data they have on their hands, which we, to a certain extent, we didn't know it was possible, because the only data that government generally would have been availing previously have been, your census that comes out every 10, 11 years. And that becomes the only data that is available in a country for the next 10 years. And then whatever reference, whatever planning, whatever, developmental aspect that needs to be taken had to be considering all the data, and which most of the time is not very specific, which is not very segregated, which is not very timely, and this, I mean, the COVID period has made us ask all those questions, that it is possible that governments can turn around in 24 hours and have fresh data covering a whole country, which would ordinarily not be very possible previously, even before COVID-19. So this has then made us to think, or to ask, so if government is possible to to plan, turn around, contain a pandemic or regulate the pandemic, given the usage of data, what else can they do? Whether it's parallel COVID-19 containment or dealing with, or be after COVID-19. I mean, because there's so many challenges that Africa have. For instance, in my country, for years, people have been crying about there has been no new public hospital built in the last 30 years of our independence. So that means that every government hospital, and I'm talking about hospital at large scale, not a public health facility, which is like a clinic or health center. I'm not talking about that, but like a big hospital. For the past 30 years, there's been no public health hospital built in the country, but government knew that. And it seems that the outbreak of COVID and how many in the data and the information that they've been producing in terms of the hospitals are not managing all the beds in what hospital, and the current hospital are all occupied. That has sort of brought the question to forth on how government can then start planning on building a new hospital in what district, because there seems to be more people in this specific area than in another region. But also even within the education sector, but also tourism, which has been, I think, the major sectors that are directly impacted by COVID. So the importance of data, we hope that beyond COVID or even during COVID, that government is realizing that the timeliness, the availability of data has enabled even themselves to picture, to strategize, to think about the next step in terms of development. And I think I'll leave it here.
Thank you very much, Nashilongo. Jimmy, would you like to build upon that?
Hi. Yes, I think I'm interested in what Nashilongo is saying, that during COVID-19, we've actually seen extraordinary efforts that governments have put in to fight the pandemic. But I think one of the main things also that we have to think, to remember about COVID-19 is that you may call it an equalizer one way or the other, that we have collapsing health systems in our countries, basically because the people that are entrusted with making decisions or making sure that we have working healthcare systems can easily be airlifted to hospitals elsewhere. But this time around, we all have to struggle within our own borders. So we also have to take that into considerations on why decisions are being made. I think in addition to that, there's also been a lot of sort of should I call it an awakening somehow, that ordinary people, citizens actually are demanding that governments do better in line with what COVID-19 is demanding. So putting in resources, pulling all the efforts together and try and really mount some sort of a fight against the pandemic. But also we know that this pandemic actually is an economic one. Basically, Nashilongo was mentioning about tourism there. Basically, there are a lot of sectors that have been hit. So all the pointers basically are there that governments have to do this. But what this tells us is that all along, basically, we have governments that are capable of actually doing better, much better in terms of providing public services. Coming to issues of open data, I think, as I said earlier on, under the circumstances, I think every government would want to have trust of their people. So if you can't be trusted, I think it's going to be difficult finding the pandemic. I'll give you an example. Last year, when the first wave of the pandemic was there in Malawi, we were in the midst of political campaigning because we were voting in June. So around that time, actually, a lot of discussions around COVID-19 figures were received with suspicion, or maybe government is inflating the figures so that they may stop campaigning, because obviously that is going to be in the interest of the ruling party to stay in power a bit longer. So people always have these suspicions. So when you have open data, when you have governments that are shown at least the efforts, I think it helps not just resource mobilization, but also it helps with actual citizenry taking part in what is happening. So it's a win-win situation. And I'd like to agree with what Nashilongo is saying, that maybe going forward, we should learn lessons here, not just to leave it to the governments to do whatever they have to do. Yes, we entrust them with our resources to run governments, but also I think the citizenry here should continue making sure that what governments are supposed to do is being done openly and fairly. Thank you.
Thank you very much, Jimmy, especially for highlighting that the citizen awareness and demand for public services. Also, highlighting or touching on government's capability to provide public services using open data that is currently available. Also, thank you, Nashilongo, also just for highlighting the public health and education situations in Namibia. So oarabile, as we cross over to you, I see a request in the chat that says, may you please kindly speak up or increase your volume on your end. So as you answer the question, what could having open data mean for African countries? Could you also go into the next question, which is to answer what sort of data or metadata is available to the public currently, so you can speak from the context of Botswana or South Africa or any other Southern African countries that you have been following up?
Yeah, I mean, I think we just need to recognize the fact that, of course, when we talk about the implications and what actually this could mean for access and use of the data in African countries in general, we first need to recognize that open data means that users can make free use of research data without actually requesting permission and without any copyright or patent violations for perhaps medical health research, which is one benefit. And it is in moments of disaster actually that, the data is typically stored in non-repository formats needed by medical experts, which allows editing and analysis for informing research in general. But making research and related data openly and widely accessible is quite an essential component of basically the open science movement that benefits increasingly during the COVID-19 pandemic. And of course, such kind of approaches promote scientific collaboration between individuals and research units that are involved in COVID-19 pandemic research. But talking of the kind of data and metadata that is available for the public, I mean, we have seen different governments adopt social distancing measures, including travel bans, school closures, and of course, quarantines. Some measures instituted to limit the spread of the virus and to reduce demand on the healthcare infrastructure. But what these approaches don't tell us across different countries in the region is whether these measures are effective. We don't have data to back up if these measures have been effective so far. So I think that is quite a limitation that we are seeing, or that we probably would want to talk about when you talk about the data available for public consumption. We need to understand whether the measures proposed by governments are actually serving any purpose. Other than that, we are just doing this for the purpose of doing it. Additionally, I think talking on behalf of where I come from, the government has instituted what they call the COVID-19 task force, which updates the public on a daily basis through infographics summarizing the number of tests performed, confirmed cases and mortality rates, and of course the regions that are affected. However, they don't talk about the age of patients and other nuanced data regarding the transmission, which is only shared on daily announcements, which I think perhaps if they made this into some sort of an infographic summarizing these details, it would be a lot more easier to disseminate this information. Perhaps maybe the government needs, data scientists to work on curating and applying, publicly available data in a way that is computer readable so that information can be shared to the entire public using both data repositories and of course, dashboards that are open to everyone. So to update the public, especially in the country, announcements are made by, mainly the Minister of Health through the COVID-19 task force. And these announcements narrate, the confirmed COVID-19 cases, looking at gender, the age, and as well as the travel history of people who have tested positive for the disease. That's just basically, how things have been looking in the case of Botswana. Thank you.
Thank you very much for those insights, Oarabile. And I do tend to agree with you in terms of most governments are simply providing information on preventative measures, on deaths, infection, and recovery rates, and not so much information that would help us to paint a better picture. I don't know what your observations have been, Nashilongo, and then we go over to Jimmy.
Thank you. Yes, I actually agree with my colleague Oarabile and you, Bulanda, on that case, that the data that is availed to the public could save or could paint a better picture or could be more effective if it was consistent. For instance, in Namibia, our data when is availed, some days, some weeks, you would have the minister announcing, for instance, that the age of those who have died of COVID, and some days that information is not available. There has been a lot of inconsistencies, but also the other data that has been largely missing is the amount of money or that government and its partners and stakeholders are spending during this. Well enough that, for instance, the public is informed what facilities, private and public, is being used to host, for instance, people who are in isolation or people who are in ICU or people who are generally just infected with the virus. But the transparency, I mean, to talk on how data links to governance and transparency, what is largely missing is the amount of money that government is spending to curb COVID-19. And that doesn't mean anything. I mean, if, for instance, it would mean so much for the public if government would say per week, given the statistics that we've just provided you with, we are spending, $10 million or Namibian dollars or US dollars or whatever. That will then help with the public in making better decisions, but also be better informed about if there's a correlation between what we're talking about and how much it costs. Constantly we're seeing the media reporting how invoices are not being invoices from the private sector have not been paid, and government obviously will be put on the spot, and they will obviously come up with the typical PR of just responding to what is there. But if data that is available, like Oarabile was saying, that would be much more inclusive, that it would speak specifically to issues of effectiveness, it would help if it has covered a lot of those things. And also one thing that Oarabile was talking about, that the use of data scientists during this period, that also has been an experience here. And I think, well, at least for people like Oarabile and my colleague Jimmy are speaking of graphics that are daily updated, and we see that especially in South Africa. That's some sort of privilege. We still have a statement that is shared every day, and that statement, no matter how clear it is to possibly a population that is literate enough to read it and to articulate it, would be totally would be much more effective. It has been translated into those graphics that and those graphics will be ingrained in the minds of a user, and would know where to look at every day, instead of really trying to read the text and contextualize what is in the text with what is in the table, and make up your own mind as a member of the public. But also, I think I had just trying to, I had prepared actually a PowerPoint presentation, and sorry, I didn't know that there was not going to be an opportunity to share that. But also, yeah, largely really to talk on the data for funding. So what does this data translate into? What is it that the country has been losing during this period? We understand that the sectors, for instance, are affected, but to what extent? Like, that kind of data is not available. So we have become so restricted into number of deaths per region or per district, number of new cases, total number, and it ends there. So further questions need to be asked. I don't know if it's from the public, but also maybe a question that needs to be pointed to government altogether, in terms of, can we have more data other than what we're seeing, because we're not reading beyond what we already know at this point.
Thank you very much, Nashilongo. Moving on to you, Jimmy, what have your observations been in Malawi in terms of the data that is available?
I'd like to agree that I think what we know mostly is the information to do with mortality, number of people recovering, hospitalizations and whatnot. And this is a standard infographic that we have in Malawi, data updated by the Ministry of Health. And also it's interesting to hear what's happening in Botswana, because it's exactly the same in Malawi, that we have what is called Presidential Task Force on COVID-19. And these are the people that are empowered basically to provide all this information. And also to agree that I think the information is not really going beyond what I've just mentioned. And I think the interesting part about this will be now that more and more African countries are getting the vaccines. I think in Malawi, I learned this today. I'm not very sure when it's going to roll out. They've made a plan that first priority, for example, there will be frontline workers, so health service providers, teachers, the elderly, and so on. You would then ask a question in this case, that we don't really have information about what are the most at high risk groups. Of course, health workers is obvious because they're dealing with patients. But other than that, then you begin to ask questions. Why teachers? Because in some cases, we are getting information that actually maybe children are not among the most vulnerable groups. So how risky is it to be a teacher in primary school, for instance? So this sort of information that we really need to have, because as governments begin to make decisions as to who gets the vaccine first, we need to have data that backs up those decisions. So I agree that information ought to go beyond just providing daily admission figures and whatnot. To go beyond that, somebody, I think, is it Nashilongo, mentioned about the amount of money being spent on what program and whatnot. I think if you look at what happened in Malawi, I think that opened up a lot of problems for the government, and they have all the reasons. Of course, we need that information, but they have all the reasons to hide extra information. So the president the other day stood up and mentioned about specific figures that have been spent on several issues. Then civil society and ordinary citizens began to question how was this money spent, you know? Then it got to the point whereby receipts have to be issued and whatnot. We've had several arrests in Malawi. A few people have been taken out of the task force and whatnot because there was lack of accountability. So you have to give it to the government. At least they tried to be open with the information, but then in the end, this is what has happened. So you wonder if the president or the task force is going to come back again to give us details of expenses and whatnot, because that has its own problems as well, because the public starts to demand more information. But I think this is what we're supposed to be doing. And as I said earlier on, I've seen a lot of civil societies being vigilant, actually, individuals being vigilant in making sure that the money is spent on what is supposed to be spent on. So we have a long way to go in terms of giving us extra information, but we need to demand this information. I don't know how other Southern African countries, I know in Zimbabwe they have vaccine now. In South Africa, I'm not exactly sure about any other countries, but it's important that we pay attention to which groups and how is it, just because there's a lot of, let's be honest, there's a lot of just speculations without really actual evidence as to who is more vulnerable. The same way that we're saying, oh, African countries by and large have been spared COVID and whatnot, because the stereotypical view or the West hasn't been met that everyone in Africa is dying one way or the other. So all these things basically are just a hearsay one way or the other. Governments should actually make informed decision based on available information, and that information has to be made available to the public. As I said earlier, one way of dealing with COVID-19 is to make sure that you have information there for people make informed decisions one way or the other. I'll stop there for now.
Thank you very much, Jimmy. It's definitely interesting to see the sort of types of data that are available across the region. Also, it's interesting that Nashilongo, you touched on the need, for data to be made available in terms of government spending, which has been a very contentious issue in most countries. And also, Jimmy, the issue of who are the at-risk populations or groups. So in the interest of time, I see we have overshot. Well, we have about 5 minutes left. I hope we can extend that to an extra 10 minutes. Apologies that we started a little bit late, but in the interest of time, perhaps we can just cruise through the next questions. We're almost finishing. We just have about 3 questions to go. So, Oarabile, I'll start with you. So do we see any open source software and algorithms being used to analyze this data? Because one of the recommendations from the Restore Data Rights Declaration is that open source software and algorithms must be used to analyze this data. So do we see any open source software and algorithms in that regard? And secondly, in terms of data sharing agreements or government policies and other key documents, Do we find that these are openly available to us as the public? Do we even have access to them? So Oarabile, I'll start with you, and then we go over to Jimmy and then Nashilongo.
Yeah, I mean, talking of, open source softwares and algorithms being used to analyze this data, I'll talk a little bit about the open source softwares. I was actually reading an article from this organization called Ushahidi, the crisis mapping tool. So they have actually seen an uptake of different countries and other organizations making use of their platform to map different initiatives used in pandemic preparedness and response in countries such as Nigeria. There's a crisis map that documents COVID-19 outbreak from verified sources. I've also seen a couple of maps actually in Kenya that deploys softwares for tracking and supplying essentials for those that are in need. But in the Southern African region, I actually haven't seen any country or any organization that I'm aware of utilizing open source softwares. But what is interesting when we talk about contact tracing methods that have been deployed to identify and track individuals who might have come into contact with infected persons. We have seen countries like Botswana using its BeSafe COVID contact tracing application. We have seen countries like South Africa also, they launched their contact tracing application. Nigeria as well, they have their contact tracing applications, I think, in a couple of states, if I'm aware. I mean, if I'm correct with that. But what's interesting about contact tracing technologies is that these tools don't actually tell us the technological details about their operations and how they manage this data. And it is quite unclear at this moment to speculate whether they are using some sort of data analytical capabilities or algorithms to manage this data. But what maybe we could fledge out from this is that could data breach, I mean, it's whether these tools could breach personal privacy, and of course, whether they are capable enough of detecting individuals who have not been exposed to other people who might have infected them. So I think the whole issues around personal privacy and whether these tools guarantee such is actually a question of concern at the moment within the civil society and of course other stakeholders. Thank you.
Thank you very much, Oarabile. And I do know that this is particularly an area of interest for you and for your work. So Jimmy, I don't know, have you spotted any open source software or algorithms that are being used in Malawi or anywhere in Southern Africa? And then we can quickly go over to Nashilongo. And as we answer that, are we also aware of any data sharing agreements or government policies that have been made public?
I don't know any actually. I know in Malawi that is not happening. The closest thing that happened is that there is an organization called MHub. I think they're working in conjunction with Ministry of Health. They're trying to have some sort of mobile information center where people could actually be sent directly information about their COVID-19 status being sent directly to their mobile phones and whatnot. But I think that has been put on hold because there are concerns about data protection. Some people raised concerns That's all that I know. But what I know for sure is that in terms of data sharing between government and civil society organizations, for example, and other stakeholders, it's not really there. I think government remain the custodians of information. All these infographics that I'm talking about is created by the government. All of us are just a recipient of that information. Thank you.
Thank you, Jimmy. Nashilongo, over to you.
Thank you. So I think Namibia is around the same situation as in Malawi. We have no contact tracing application that obviously uses the open source or open data mechanisms that I'm aware of. I also know that at this point that our data is centralized or highly just controlled or managed by government. So civil society is on the backbenches, like with the rest of the public, just receiving information like everyone else. There was a second part to your question, Bulanda. Sorry. Yeah, so there was a second part to your question that I might have missed. But generally also just to say that, open sources and open data softwares, I think that kind of discussion is also very, very low in countries like Namibia, but also possibly because we, like some countries, we do not have a data protection bill. I remember earlier in the pandemic, a lot of Namibians took to social media, asking, for instance, that the identity of those who were infected by COVID at that point must be named or must be veiled, so that people know who to talk to and who not to talk to. I mean, that also speaks obviously to the issue, to the level of awareness of personal data protection. So I'll end it there.
Thank you very much, Nashilongo. You've actually already answered both of the questions that I had. So it's safe to say that the public and CSOs basically are not being consulted, on how this sensitive data is being collected and used, judging from all the sentiments in the room, which brings us to our last question, which is, what appropriate steps have been taken to protect data that may be used to identify individuals or vulnerable groups? If we are saying that currently the data that is available is to some extent insufficient to help us, dig deeper into the issue, but do we see any sort of safeguards that are being put in place to protect individuals' identities and identities of vulnerable groups? Jimmy, would you like to go first, and then back to Nashilongo, and Oarabile can sum it up for us?
All right. I think I don't think much of in much of the countries have been thinking about this, because I know I've been involved in these conversations. For example, in your workplace, if somebody has contacted COVID-19, it's in the interest of everyone, and this is what we're being encouraged to do. You need to tell people so that those that had been in contact with you also get tested or go on self-isolation and whatnot. But then we also have to think about that. Okay, so people have certain information that they have to keep confidential. So there are not clear guidelines on this, and I know for sure that there are people that would rather not say they have contacted COVID-19 when they have it, and there are those that are open to saying it. But I don't think there are, at least not in Malawi, there are any clear guidelines on this, and in particular, how do you protect the vulnerable people in society as well? And I think this is something that maybe hasn't been thought about, at least as far as I know. So thank you.
Thank you very much for that contribution, Jimmy. Nashilongo?
I think for Namibia in particular, the saving grace, especially for personal data protection with that level has been I think is that the public charter or like a public health, like there's a law that that prohibits, for instance, government to share data of a client, especially of a public health client, with the rest of the public. And so hence when people were asking for identities or personal identities of those who were infected by COVID, that has been used as response. However, other metadata, for instance, it is known that the first case of COVID in Namibia were those of a Romanian couple. I have also a small graphic that I have produced to this effect, and just the jibs around that. But to this date, the identity of the real identity of what are the names of this Romanian couple who were tested first COVID positive in Namibia in March 2020 is not yet known. We know, for instance, what facility where they were housed in as tourists, what hospital they went in, the stages of their recovery, but never about their names and where they came from. And that also has been with all the other patients. I know for a fact there was a case of possibly one person that came forward and was used by a commercial entity, which was a telco, to tell their story or their journey around COVID. But other than that, that kind of information never really came through unless a person has said, I have tested and I have recovered.
Thank you very much, Nashilongo. And it's also interesting to learn that Namibia has a public charter on public health. Oarabile, would you like to sum the discussion up for us as you answer the question on the appropriate safeguards that are available in terms of protecting individuals' identities as well as vulnerable groups?
Yeah, I mean, the government actually, you know, as you might be aware, passed the Data Protection Act, which was assented by the Parliament on the 3rd of August in 2018. And it is currently on notice and awaiting commencement. I believe through the Data Protection Act, it helps regulate the protection of personal privacy, and indeed it ensures that the privacy of individuals in relation to their personal data is maintained. But what's interesting, during the launch of the BeSafe contact tracing application, there was so much scrutiny with the so-called technology company that donated the application for free to the government. And you know, the CEO of the company came out defending the decision that, you know, indeed the application is privacy friendly, and they are taking so much precaution to protect individuals' privacy and data. But then what the government doesn't tell us is how they are processing the data that they collect through this application, and who is managing this data, and whether this data is being managed by the government or the so-called company. So those are kind of questions that, you know, even up to now still linger within the civil society, and there's still no quite clear answers as to how the government is managing this data, except that we are being guaranteed of our individual privacy as they collect this data.
Thank you very much, Oarabile, and hopefully next time we can have more time to explore some of those questions that you have raised. I see we have spent all of the extra 10 minutes that I had asked for, but perhaps we can quickly just open up now to the other participants for their contributions, just so we don't keep anyone longer than the time that we had provided for. Any contributions, questions from the other participants in the room? And as you think of your contributions, let me just draw your attention to the chat section. So I've posted some Twitter handles, some hashtags, as well as the declaration on restoring data rights, and kindly complete the survey also, that you will find the link in the chat section before we exit this meeting. Any contributions, kindly just unmute your mic and speak up. GS, Rigobert. Okay, so
Just to
nothing more.
thank, yes,
Go ahead.
thank for the session.
Rigobert, you were saying something?
Yes, I said thank you for the session. Any contribution in my side? Thank you for this discussion. I think it's okay. Good contribution from speaker also.
Thank you very much, Rigobert, and we look forward to the Francophone discussion. Any other contributions? Emmanuel?
This was a very great panel, and I think I've learned a lot, but I think the similarities in all the African countries are almost the same. And as usual, it's just a copycat everywhere on the continent. But I think at the end of the day, either government or civil society, we are all, grappling with the same issue. So at the end of the day, what kind of data they are collecting, that data should play a role, in ending this pandemic. So as Oarabile said, the kind of data government is collecting, is it serving public interest? It should serve public interest, but at the same time also respect, the citizens' rights. So I think that is my little contribution to it. We are dealing with the same issue, all of us. So we just have to collaborate and, help our government assess and share those data when it's needed. Thank you.
Thank you, Emmanuel. Any other contributions? Okay, in the absence of further contributions, just to say thank you very much to our participants, to our speakers. Thank you for being here this morning. And the message really is clear that we need transparent, inclusive, accountable COVID-19 data governance, so that we ensure that citizens have the right to know how their data is being used to fight the COVID-19 virus, as well as the right to say no to data abuses. So thank you so much for joining us this morning. Thank you for the insightful contributions and the robust discussions. I wish you all a pleasant weekend. Thank you very much.
Thank you. Bye.
Thank you. Thank you for having us. Bye.
Bye-bye.
Yeah,